12:03. I think we can go ahead and get started. Good afternoon or good morning, wherever you're joining us from today, and welcome to our Workshop Wednesdays webinar series. I'm Sean Forbes, an HR specialist with CMS, and I'm joined today by my colleague, Marla Lazarus, who will be monitoring today's chat. Before I introduce today's speakers, I'd like to go over a few housekeeping items. As you just saw, this webinar will be recorded. We record these so we can post them to our YouTube channel. Marla will be posting the link in the chat below. And this is where all of our previous webinars reside. So you can go back and view them at any time. If you have questions today for either myself, Marla, or any of the panelists, please feel free to ask your questions in the Q&A box. Marla will be answering them during the webinar, and if we have time at the end, we'll ask some questions for the panelists. Also, if you could stick around towards the end, we'll also be launching just a quick poll. So now that housekeeping items are out of the way, I'm thrilled to kick off today's webinar. Again, my name is Sean Forbes. I work for the Centers for Medicare and Medicaid Services, or CMS. CMS is a federal agency that provides health coverage to more than 100 million people through Medicare, Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. Within CMS, we have 6 different centers and 17 offices that support our mission. And today, we'll hear from 2 of them. What's today about? Today's webinar really shines the spotlight on these centers and offices within CMS. We're going to hear from employees about their experiences and what it's like to work for CMS. I'm happy to introduce our speakers today who will join us from different components throughout CMS. Our first speaker today is the Director of the Office of Hearing and Inquiries, Randy Brower. Following Randy, we'll hear from 3 employees from the Center for Clinical Standards and Quality, also known as CCSQ. Dr. Sherry Ling, our Deputy Chief Medical Officer, will be joining us along 2 nurse surveyors, Lieutenant Commander Jackie Rodriguez and Becky Elkins. We're so thrilled to have them all join us today to hear their experiences, and we're so glad to all the attendees who joined us today as well. So without further ado, I'll turn it over to Randy. Randy, it's all yours.
Thank you, Sean. Welcome, everybody. I'm glad you had an opportunity, and may I say you're very lucky because you got the 2 strongest parts of CMS here to talk to you today. So as Sean said, I am very lucky to be the director of the Offices of Hearings and Inquiries, and I thought I'd spend a little time today telling you what that's all about. Giving you a sense of the sort of work that we do and what it's like to do that kind of work, how that meshes into the larger agency mission, which is a very big one, and then a little foreshadowing, if you will, of some of the needs that I think my office is going to be looking to fill in the coming year. So as Sean mentioned, right, CMS is an agency with a big mission, right? We support the 3 programs that Sean described, and that amounts to about a little bit more than 150 million American lives. That's a lot of people, and it's an enormous responsibility, but it comes with not only incredibly hard work, but extraordinarily rewarding work to be a part of the machine that helps to ensure folks can receive affordable health care and the best health care that the world has. It really is pretty amazing. So a little bit about my office. The Offices of Hearings and Inquiries exists to provide a mechanism for individuals to raise concerns with the agency, either informally or formally. And for that, we have this kind of arm's length relationship with CMS. And it's my job to make the bridge between the work that we do and the larger agency structure. So the sorts of informal inquiries that we might get range from customer service inquiries all the way up through grievances or complaints that people enrolled in our programs might file. So in our office, we have 3 ombudsmen who support the Medicare program, their roles having been created in the law. And one of them focuses on beneficiaries and their caregivers' inquiries and concerns. Another focuses on pharmaceutical and technology manufacturing outfits and how to help them navigate the federal process to get their new and exciting products into market, as well as into coverage in the Medicare program. And our third ombudsman supports the competitive acquisition world in Medicare. And without too many boring details, basically what that's all about is the law introduced a mechanism by which certain suppliers of durable medical equipment items, that's things like wheelchairs or walkers or oxygen, those suppliers compete to set prices for their geographic areas. And so there's an ombudsman that exists to both hear concerns from customers in those areas, as well as from the suppliers who are bidding to be a part of that work. And so, as you can imagine, right, through those three different lenses, we get an awful lot of inquiries, and it can be really interesting to go down so many different paths to try and resolve either a concern or an issue, or to just help someone get connected to the right part in the agency to be able to, continue on their way or get the answer that they need. We also do a lot of data correction, right? So as you can imagine, helping to ensure that health insurance coverage exists for 150 million plus people, there's a lot of data and a lot of technology behind that. And so sometimes data records need to be corrected. And of course, we interact with providers, hospitals, states, insurance companies, and on and on and on. So all of those sorts of data feeds can sometimes run into the technological difficulties that we all experience from time to time. And so my team responds to and corrects many of those data issues, particularly in the Medicare program. Other types of informal inquiries that we handle in my shop is ensuring that every participant in our program has accessibility materials that are fully accessible for individuals with disabilities. So if someone in Medicare, for example, needs to receive their information from our agency in Braille or in large print, we will make sure that that happens for them. If somebody in the marketplace needs help navigating, one of the online mechanisms or needs an interpreter, we will make sure that happens for them as well. So that's kind of the informal side of OHI, and that amounts to somewhere in the range of about 250,000 inquiries every single year. On the formal inquiry side of OHI, we provide for independent administrative adjudication across about 24 different legal authorities. And so this ranges from contractual disputes between an organization that's seeking to be a partner with the agency to provide healthcare coverage, like, for example, a Medicare Advantage plan, or for payment disputes between such an organization and the agency, like, for example, how money flows into marketplace issuer organizations. We also support 3 independent boards. And so these boards exist to ensure that, it's 2 independent boards, 3 areas, 2 boards, apologies. The 2 boards are the Provider Reimbursement Review Board and the Medicare Geographic Classification Review Board. These are statutorily established and staffed with appointed individuals, and it's their job to hear the inquiries that fall into those lanes. So first, in the Provider Reimbursement Review Board, or PRRB, this is a 5-person panel that hears concerns or appeals from Part A provider entities. Largely, this is hospitals, but it can also be organ procurement organizations and other similarly situated entities. They have a right in the law to appeal if they disagree with the final auditing outcome of their cost reports. Cost reports are very complicated, and I won't try to go through that today. But suffice it to say that there's a mechanism by which, in addition to claims payment that these entities might receive, they also have an opportunity in the law to claim other funds that are available to them that help support things like ensuring the uninsured expenses borne by hospitals are supported by the federal insurance programs. So these entities can appeal, and they do, and it's the board's responsibility to hear those concerns. So my shop provides that board with basically law firm type support, right? So we have attorney advisors, accountants, other professionals who provide advice to the board as it deliberates its decisions. On the Medicare Geographic Classification Review side, right, very long name, that is, again, for Part A providers, largely hospitals who are looking to have their geographic classification in the Medicare program revised for the next payment year. So in the Medicare payment scheme, which again is very complex, but in that scheme, one of the sort of core pieces is whether or not your hospital organization is urban or rural. And many organizations have an interest in revising that, either because things have changed where their hospital is located, or because there's a financial impact at being designated one versus the other. So every year, we receive applications for the appeals board, the Medicare Classification Review Board, to review those applications and make a decision as to whether or not that entity ought to be reclassified. As far as volumes are concerned, somewhere in the neighborhood of 700 to 900 of those different appeals come in every single year, and somewhere in the neighborhood of 3,000 to 5,000 appeals come through the board every year. We put out about 3,000 board decisions every month. This includes not only hearings, but also other legal actions that must be taken throughout the course of an appeal. Motions are filed, decisions are made. There's a request for expedited review for certain issues to launch their pathway into federal district court. We're also responsible for maintaining that record. And so creating the appeals record is a huge responsibility. It is the foundation on which any further litigation would be based. And so there's a lot of effort that goes into ensuring that's done. To help all of those things get done, largely the staff in our formal inquiry side of the house, or our hearings side, are divided up amongst attorneys, attorney advisors, which are usually paralegals or other professionals, accountants, folks with a medical background can also be helpful in certain of our cases, which I'll talk about in just a moment. So wrapping that all up, what is the Offices of Hearings and Inquiries? We exist in order to allow for both due process, which is required in the law, but also an independent arm to which a concern can be raised if it hasn't been satisfied in another part of the agency. And that provides a number of important benefits, right? One, it's simply the right thing to do. But two, it gives us an opportunity to hear that sort of feedback and provide it back into the larger agency so that the people who are doing the reg writing and policy making have that information in mind and can consider it as they're looking to make changes to the programs. Looking ahead, what might be on the horizon for hiring in the Offices of Hearings and Inquiries? Largely, my expectation at this point is what we'll be looking for is to augment our formal side of the inquiry mechanisms. And that would mean hearing officers, as well as those individuals who support them. So our hearing officers are attorneys and need to be entered into the bar in at least one state. And our attorney hearing officers are appointed by the Secretary as an Article II inferior officer so that they have the authority to make the decision in the cases before them. A large body of work that we are gearing up for is in relation to a particular audit that will be happening or is already happening. And in response to that, we'll be also looking for support staff who may or may not be attorneys that have medical coding background, as well as other relevant backgrounds such as accounting or different medical disciplines. That's the area that I see the most growth in. For OHI, having said that, right, as our programs grow, there's always more questions from more enrollees in any one of our programs. So there's the door is always open, so to speak. And I encourage anyone who has an interest in this unique part of CMS, which is one of the few parts that is directly connected into our beneficiary population day in and day out. If that interests you, I would ask that you pay attention to USA Jobs and other posting mechanisms that I'm sure our HR folks can tell you more about to look for opportunities that might exist in my office. With that, Sean, I think that's about all for my prepared remarks. I am happy to either answer a question or two or have the pleasure of listening to Dr. Lang and her colleagues.
Thanks so much, Randy. It's great to hear these stories throughout the centers and offices, throughout CMS. And you brought up a great point that I just want to, tell our viewers. You mentioned about the positions that will be opening. So all of our positions will typically always be posted on USA Jobs. We can post the link down in the chat to CMS's USA Jobs posting, which will show you everything that the agency has open. But again, thank you, Randy, so much for that.
My pleasure.
Turn it over to you.
So, good day. I'm Sherry Ling, Deputy Chief Medical Officer for CMS. I have the honor of serving the agency in a variety of capacities. But by way of background, I'm a gerontologist and also a geriatrician, the distinction of which is gerontologists actually study and serve people, beneficiaries, patients across the age continuum. So gerontology is the study of aging. I'm a geriatrician as well, which means I provide medical care as part of an interdisciplinary team to older adults who have a variety of both acute and chronic conditions. So what I do for CMS, however, in my role as the Deputy Chief Medical Officer, is I have the honor of advising and helping to shape the programs and policies as they roll out in a variety of ways that the agency is authorized to implement. So we are an implementation agency that has impact on a very broad and growing population of our country. I will say one of the challenges and immense opportunities is that the population that we serve through CMS programs, whether Medicare or Medicaid or new markets, the population is increasingly complex. And so we have the opportunity to bring to bear how we would translate evidence into programs and policies that actually help to improve outcomes for those who we serve. Health outcomes that are not necessarily specifically just about a single instance of healthcare service or services or delivery. Today I am actually representing a community of clinicians, and the clinicians who I have the honor of working with and serving with include, I think we have 44 physicians at the current time across CMS, including other CMS locations. We have physicians, we have nurses, physician's assistants, social workers, pharmacists. I'm running the risk of leaving someone out, as one would when we thank our guests at a wedding. But importantly, also our therapist colleagues, physical therapy, occupational therapy, speech and language. We have nutritionists, dietitians. We all come at the needs of are beneficiaries from different angles, but all really focused and converging on what is it that we can do as an agency to enable the best possible health outcomes for those who we serve. I will say that in addition to the broad scope of CMS and complementing the work and the opportunities and processes that Randy actually spoke to within the Center for Clinical Standards and Quality, and I think you'll hear more details here. Some of our programs include focusing on the health system and through improving quality through either quality measurement or quality improvement to actually raise up the health and safety standards of all providers who participate in Medicare across the country, from hospitals to nursing homes and providers anywhere in between, by being clear about what the expectations would be to participate in Medicare and as a payer and as a regulator. We also lead the coverage determinations, which really build upon the evidence to suggest that certain treatments and services are not only safe and effective, but also have utility in the care and keeping of those we serve. And, you know, the coverage, quality, all of this and the safety standards also build on the same body of evidence, and that body of evidence is also referred to and built upon when it comes to the enforcement of the safety standards. And I think you'll hear a little bit about that as well. So you can see how the clinical perspective actually is infused into the work that we do, not only between the groups in the Center for Clinical Standards and Quality, but also across the agency. I will say that I began my career as a direct service provider, providing counseling to older adults, and then pursued medical training, so medical school and post-graduate experience and training as a geriatrician. I've worked in three settings over my career, starting out as in a academic setting, moved over into purely research, helping to build the infrastructure and the understanding of what does normal aging look like, important foundation for and broad-reaching implications for that work, and also then working at CMS. And I think what brought me to this agency was the opportunity to really be at the cutting edge of programs and policies with tremendous scope and impact. What I have learned, and I am very proud to say that what has kept me here at the agency, and I've been with the agency for well over 10 years now, is the people who have come here and who I have the honor of working with. Our staff, very, very mission focused, mission driven, bring their A games to the job each day, because it is a point of service, it is an honor of service, and I couldn't be prouder, and just a tremendous honor to be here and to have a chance to speak with you today. So if you really, if you want to change the world and do it in a way that actually helps assure and deliver to better health outcomes, which is kind of what we all want for ourselves and our families. You have an amazing team that you would be joining. So with that, I will turn it back to you, Sean. Thank you. Over.
Thanks so much, Sherry, for sharing your story today. And we get that question so many times at recruiting fairs or webinars about what it's like to work at CMS. And we continually tell people that everybody is so passionate about the work that they do within the agency. Whether you work in communications or CCSQ or OHI, everybody across the agency is just super passionate about the work they do, and I can't stress that enough. I will now turn it over to Lieutenant Commander Jackie Rodriguez from CCSQ as well.
Hello, good day to all our viewers. Thank you for the introduction and for having me here. I'm really excited to be here and share a little bit with you of what I do. I'm Lieutenant Commander Jacqueline Rodriguez, and I'm currently stationed at the CMS Boston location. I'm a nurse consultant with the Survey Operations Group and a nurse officer with the United States Public Health Service. I have been with CMS for over 4 years now. I have over a decade of clinical expertise in primary and acute care, working with patients in private sector hospitals and underserved populations. As a CMS nurse consultant, I oversee regional survey operations and processes within the 6 New England states. I do a lot of traveling regionally and sometimes nationally. I also work out of the Boston office. Survey and certification is a system that provides on-site objective and outcome-based verification by trained individuals to assure that basic standards of quality are being met by healthcare providers across the nation. Or if they're not being met, that appropriate remedies are promptly applied and implemented effectively. CMS surveyors consist of many professions: social work, dietitians, physical therapists, pharmacists, but a majority of them are indeed nurses. More than 200,000 providers, suppliers, and laboratories are subject to the certification and survey processes. My current focus is with nursing homes and hospitals. CMS accomplishes these quality assurance functions under specific direction from the Social Security Act and jointly with states, accrediting organizations, and contracts with qualified organizations. We engage with beneficiaries and their families, state agency leadership and their staff, and the provider community. Our mission is to assure basic levels of quality and safety for all patients, residents, and clients receiving care from Medicare and Medicaid certified institutional providers. I've always had a passion for serving underserved communities and have been fascinated by the diversity that comes with that. I also had a strong interest in health policy that further developed during my graduate education. Both my passion and interest, along with the direction from a good mentor, was what originally drew me to CMS for career opportunities. I thought I had a good idea about what CMS is and what services the agency provided, but I soon realized that I had a lot more to learn. For me, CMS has been an opportunity for continuous learning and growing as a professional. CMS influences and touches the healthcare system in every way if you really think about it. With CMS, I've had the opportunity to work strategically to solve issues at the state and national level via collaboration with other diverse and talented professionals. CMS has staff with a wide variety of skills and backgrounds. At CMS, I found a dynamic, collaborative, innovative, and very inclusive work environment. Much of the work we do is exceptionally complicated and technical, so it requires a great degree of thoughtful problem solving. We need to solve problems that have never been solved before, and we also need to continuously improve systems that are currently in place. The mission is better care for our beneficiaries and transitioning that into the future. When I first started as a trainee, I learned to evaluate patient healthcare delivery systems, and public health situations for compliance with a complex body of healthcare regulations. Any situation, if you think about it, within the human experience can potentially come into play. It is the surveyor's role to analyze these situations and place them in the context of the regulatory framework. Federal surveyors also oversee the work of state agencies and private contractors who conduct federal surveys. This role requires specialized assessment and communication skills. With my nursing and public health expertise, I was able to complement the work being done as I trained and felt really valued by the agency. I also felt appreciated by my colleagues, some of who have been at CMS for over 20 years. I was really surprised by that, and the longevity I've seen at CMS really speaks volumes. I was assigned a mentor when I started and continue to work closely, not only with those within my department, but also with other departments. The work at CMS requires collaboration and team building is facilitated. We have access to the latest communication tools, platforms, and technology to complete our jobs effectively and seamlessly. The survey operations group in particular, their goals consist of not only improving quality of care in the healthcare setting through oversight and achieving operational excellence, but also includes strengthening the survey operations group culture and enabling togetherness and honoring locational differences. It's great to be a part of a team that is so forward thinking and using behavioral economics and human-centered design to improve. Another important factor for me as a professional is work flexibility. I'm able to work both in the field and in the office setting. To me, as a nurse, it is really important to maintain my skill set and be involved at the patient care level. CMS provided me with that balance. During the public health emergencies, I conducted focused infection control surveys and recently served as a subject matter expert on the Region 1 Interagency Task Force for the prevention of COVID-19 in the long-term care environments. This task force published numerous regional reports and recommendations that strive for maximum mitigation of negative outcomes and employ evidence-based best practices in an effort to provide high-quality patient care. Due to the focused infection control surveys, I trained as an infection preventionist and a food safety manager. CMS provides you with so many training and education opportunities and really encourages you to broaden your professional brush. I didn't anticipate training or educating myself in those roles, but CMS changes as situations change. In my opinion, CMS continues to be one of the best opportunities out there to influence all aspects of the healthcare system and have meaningful impact. I've had the opportunity to work on projects of great substance and take on leadership roles. Most recently, due to the pandemic, I've been able to train staff, been a part of creating national protocols, standard operating procedures, and newsletters. I've had the chance to wear many hats and was given the tools to be successful. I've had the opportunity to be innovative and creative, which is really important to me as a person, and being in an environment that encourages that and allows for it is wonderful. I enjoy interacting at all levels with beneficiaries, providers, and state level stakeholders, and making progress towards achieving quality healthcare, especially when it affects those who are most vulnerable. Working at CMS has been really a rewarding experience for me. My colleague, Rebecca Elkins, who actually works with me in out of the Boston location, can further elaborate on her perspective.
Thank you, Jackie. So as Jackie was saying, my name is Rebecca Elkins, actually Rebecca Elkins Pogarian. I got married last year and made my name longer, but I'm better known as Becky Elkins. Everybody calls me Becky. I am one of the newest members at our Boston location at CMS. I joined the team in July of 2019, and I've been very honored and fortunate to work with such a diverse education group of people. Jackie was one of my mentors, and they all welcomed me with open arms. A little bit about myself and how I came to join CMS. I started my career, I'm an RN, and I work as a nurse surveyor. although not all of our surveyors are nurses. We need surveyors with broad backgrounds. We've got a therapist on our team. We have a pharmacist on our team. And Jackie and I are both nurses. But, the one thing I've learned with working with this team is that you really need that type of diversity, and you really need that type of collaboration. As Jackie had said earlier, there are times that we're faced with making decisions where they've never been made before. There's a new situation and something's coming up. And, I think the world saw this in the pandemic that we're still facing. And even this morning, the team and I had an opportunity to collaborate with the state agency on an issue that they had. And our whole team was together, and everybody gave their own viewpoints, insights, expertise, and we worked out the issue and gave guidance to our state agency. I started my career in acute care. I worked on a med-surg cardiothoracic unit, and I worked in a step down, step down to an ICU unit. Beyond that, I went into long-term care and skilled nursing facility. I worked there in a variety of roles. And then I obtained my nursing home administrator's license and actually ran a facility for 3 years. That taught me a lot. And I feel like I bring a lot to the table from what I've learned from that experience. From there, I learned while I was there, I did a lot of quality and safety work, and it really, really intrigued me. So beyond that job, I went to work for the Mass Quality Improvement Organization. The quality improvement organizations are organizations that also they're mandated, and they go out to healthcare facilities, and they work with providers on how to provide quality care under CMS directed quality initiatives. So I worked with them for about 5 years, learned a lot, and then took my career over to the Massachusetts Department of Public Health, where I became a complaint investigator and healthcare surveyor. There, I learned even more about regulations, enforcement, but more important, the quality of care being delivered to all Americans. And our role in delivering that care and providing oversight to not only the providers, but our state agencies. And we do this all together as a team, not only with our own office, but we've collaborated with other regions as well. We have access to so many different expertise, physicians, all different areas of healthcare, and those that are not clinical workers. And it's really great to pull that all together. CMS has given me the opportunity to further develop my education. While working here, I work with hospitals, long-term care, and dialysis centers. And just recently, CMS was piloting a new program for home health, and I was given the opportunity to participate in that, because one of the things CMS will often do is that before they just put something out there, they do seek feedback from across the nation, from all of us. And they want that feedback as to what will work well, what changes can be made before a final product is actually put out there. And I have really valued that a lot. As I said, I had also obtained my my certification. I'm a black belt in Lean Six Sigma, and I really enjoy quality. And when I was with the Quality Improvement Organization, a lot of the work that I did was help providers. I was program lead for the hospitals and the nursing homes. And a lot of the work we did was go in and help them utilize quality improvement tools and processes to improve care and make care safer. And I bring that up because that's exactly the mission of CMS. And that is one of the things that really drew me to CMS. I had the opportunity in my younger years to work in the private sector, and then to work at the state level, and to be given the opportunity to be able to come to CMS and work with across the nation with a vast difference of people was just an opportunity I really, really wanted to take advantage of. And I have really enjoyed every minute of it. In addition, I think CMS has done a great job with work-life balance, which I really appreciate. I have 3 children, and having that balance is so helpful and really makes it, I think, easier for me to really work and concentrate on the things that I need to. It actually really helps you to focus and make things work. And I've appreciated that. And CMS was doing this before. We all know what happened with the pandemic. And I think that CMS, with the staff that we have, we kind of seamlessly fell right into that role. We were already, doing conference calls, and we were already, at times working from home and writing, and the autonomy that we have in our jobs it worked really well. And as Jackie has said, when the pandemic hit, we were out doing more surveys, but learning even more about infection control. I know that I took the CDC class, became certified there with the infection control for long-term care providers. And it was great to have the opportunity to learn so much and to be able to help providers and all of our state agencies, as well, as we were all in such a unique, different world trying to help each other out. And I think that's really it in terms of, I've appreciated everything, and we need so many different people that I think, CMS really has been able to offer that. There's something for everybody. Thank you.
Thank you, Becky, for not only sharing your story, and Jackie for both sharing your stories, but also the important work that you're doing across the country. We can't thank you enough. And Becky, point, we are always looking for people to join us at CMS. I saw Marla posted the link to USA Jobs, where all of our open positions will be posted. And if they're not posted now, they'll most likely be posted later. And we can talk a little bit about that at the end on how to set up a saved search so you can be notified when new positions do come available. But right now, I'm going to check in with Marla to see if we have any questions for our panelists.
Yes, we do have a couple. We have actually a question for everybody. So Becky and Lieutenant Commander Rodriguez, their question just came in to ask about, and Becky, I think you touched on it a little bit, but what type of other skills are needed for the survey group, the survey operations group, if a clinical or medical background is not required?
So I think Jackie might, given she has more experience than me, might be better able to answer this. But from what I've seen there, we have assistants that have helped us. We have people in finance. We have people in enforcement. We often work with different doctors, lawyers. So, I mean, it's so vast, the knowledge and skill sets that we utilize. It's not just clinical. We need people with backgrounds in all kinds of political issues, things that we're really looking to just collaborate and understand across the board. And Jackie, if you have anything to add.
Yeah, Becky, great job answering that question. I mean, we work with a broad range of professionals and backgrounds, attorneys, and not just medical. There's the enforcement team. And they don't have medical backgrounds. If it is a clinical situation, it's moved into the surveyor realm, but there's just so many. Social workers, we work with all different professionals.
Thank you both.
Can I just add, I'm sorry, because of course I gotta jump in and add something else. I just wanted to add too that I think the other thing to be important just to consider, if anybody, is considering, is this something that's right for me or something I could qualify for, is that CMS provides a lot of training. I know that I came with a vast background, and I mean, I'll tell you, I value the training that I've been given and really need it. It's different. And so they do take the time. They really take the time to train and offer, the skills and services that you need to be successful. So I just wanted to point that out because I think that's important sometimes for people to realize.
Awesome. Thank you both. Sean, if you don't mind, I'll just ask the next question to Randy, so you mentioned some support positions available in Ojai, and this particular participant wanted to know, are there any paralegal positions that you guys hire for?
Sure, and thanks, Marla. So yeah, very much like, Becky and Jackie were talking about, it takes a village, right? So there's all kinds of skill sets. And yes, specifically to your question, a lot of folks on staff in my world are in fact paralegals. But we have lots of folks. We have folks who are IT professionals, folks who are contract managers, folks who conduct other types of hearings, like our marketplace eligibility hearings, which aren't quite as formal, but are still a formal proceeding. It really does run the gamut. But to your specific question, yes, paralegals are a skill set that we look for. And I would think that in the coming year or so, that is likely to be a role we will be looking to expand. So please do stay tuned to USA Jobs for those announcements when they come out.
Awesome, thank you. And then one more question that came in, and I'm going to direct this to Dr. Ling. You mentioned improving health outcomes, and one participant was curious to know, is there a specific tool that you prefer to use to measure those health outcomes?
Oh, and thank you for the question. So there's not a specific tool. I think, and the reason being is if we want to enable our health system, our clinical providers, our facility-based providers, the facilities themselves to be able to measure and improve on health outcomes, it needs to be consistent and fit into their workflow, their data systems, their data sources. So administratively, we have begun by looking at some of the Medicare claims as an example, readmissions or admissions, emergency department use, and these are administratively defined. They're a starting place, and sometimes appropriate course of care results in an emergency department visit. Other times, it may be a signal to us that a opportunity may have been missed. It is not for CMS to actually be practicing medicine per se, but importantly, we encourage health systems and healthcare providers to be able to track their own populations and how the outcomes could and should be measured. Having said that, we also have been working with other agencies, NIH, the Office of National Coordinator, to really be able to integrate into the workflow the ability to measure health outcomes such as your ability to function, mobility, self-care, for clinicians to know what cognitive challenges a beneficiary or a patient may have, which could have implications for their ability to manage their medications and adhere to what is recommended. So that work is really important and is laid out by the requirements of the Impact Act of 2014. So that aligns also with patient-reported outcomes that NIH uses through the PROMIS tools. So there are many ways that we can think of how to be able to measure outcomes, and outcomes measured both at the point of care and at the system of care. But I appreciate the opportunity to just shed some light on the how as well as the what. Thank you.
Thank you, Dr. Ling. And Sean, if you just want to touch on our current posture in our telework landscape, we had a few questions about virtual positions.
Oh, absolutely. Thanks, Marla. So as Marla mentioned, so our telework and our virtual, we'd say roughly about 95% of the agency is working remotely right now. But for those of you that are interested in applying to new positions, we tell people that the position will most likely begin remotely, but with the expectation that you would come back into the office at some point to wherever that location is that's listed on the USA Jobs announcement. Prior to COVID-19, while we did have a robust telework policy, we did not have telework for new employees, or excuse me, full-time telework opportunities for new employees until you've been on board about a year. So that's kind of our telework stance and where we are right now with working remotely. So thanks, Marla, for that. If there's no other questions, I'd just like to thank everybody today. Thank all the panelists who spoke and who shared their stories. Marla and I love hosting these webinars. We talk about everything from federal hiring to USA Jobs, but we really love these webinars where we get to hear, from people within the agency and hear their stories. So again, thanks to the panelists today, and thank you for all the attendees who've joined. We're going to launch a quick poll. Your feedback, really helps us. So, please take a moment and fill out the quick survey. It just helps, guide our future webinars. And those who pre-registered will receive a follow-up email, and then this webinar will be posted to YouTube and our YouTube playlist that's in the chat sometime in September. And if you enjoyed this and you want to hear other webinars, we do it every first and third Wednesday. And our next event is about the Presidential Management Fellows, or PMFs, and that one's on September 1st. So please make sure you register, and we hope to see you next time. Thank you.